Good afternoon, everyone. Welcome to the snowy and frigid winter day. We're happy that you're here with us, staying toasty and warm. Today's topic is on the history of psychiatry. And with us is MHAM CEO and President Marianne Huff. A couple housekeeping items. I will have everybody on mute, but at the end we will do Q&A. And at that point, you can drop your questions in the chat or unmute yourself and ask your question, but do drop questions in the chat throughout because I know Marianne will be stopping to see if we have anything going on in there. If you need a certificate of attendance, please let me know. I'll be happy to get that out to you today. So with us is Ms. Huff. She is an LMSW and has 20 plus years of leadership experience, including 15 years of executive level staff leadership and advocacy within the behavioral health field. Prior to MHAM, Marianne served as the executive director of Allegan County Community Mental Health Services for 6 years and as the director of advocacy for the Ability Center of Greater Toledo in Ohio. Additionally, as an advocate at the Michigan Protection and Advocacy Service, Marianne helped individuals and families access mental health services and uses her personal lived experience to optimistically and passionately lead, advocate, and educate to improve the lives of those who struggle with behavioral health challenges and eliminate barriers to the timely and effective treatment of severe mental illness. Welcome, Marianne.
You. Thanks, Kristen.
You're welcome.
Hi, everybody. I hope that you are finding ways to stay warm. I realize I was saying to myself, wow, we're actually having winter. It's been really cold. You guys probably already know that. Thank you for joining us today. A lot of you are familiar to me. Some of you are not. Thanks for joining us for this webinar about the history of psychiatry in United States and Michigan. Of course, it's incredibly abbreviated. I'll also talk a bit about the history of mental health in Michigan too, and hope you find it enjoyable. This is one of those topics that I love to talk about this. As you probably heard Kristen talk about, my background has been in the public mental health system. I worked in the system for 15 years and have spent most of my career as a disability rights advocate or working for an advocacy organization. MHAM, or the Mental Health Association in Michigan, want to just touch on us real quickly. We actually are celebrating our 90th year. We were founded on January 7th, 1936, and we were incorporated in 1937. So we've been around for a very long time. And this organization has had a huge role to play in the development of mental health public policy in the state of Michigan. For example, and our name has changed, but when we became the Mental Health Society, the Michigan Mental Health Society, we actually helped found the Michigan Association of Community Mental Health Boards, which is now known as the CMH Association of Michigan. So we also played a role in the drafting of Act 258 of 1974. For those of you that are familiar with public mental health, that would be the Michigan Mental Health Code. So we've had quite a role. On a personal note, I think like a lot of people who end up working in mental health, I come by it through having many family members who have had serious mental illness. My grandmother, my dad's mother, Martha, and my dad's brother, Peter, both had schizophrenia. Both of them were in state psychiatric hospitals. My grandmother was actually a resident at what we know is, if you ever saw the movie The Road to Wellville, my grandma was actually at the Battle Creek Sanitarium and then eventually at Ypsilanti State Hospital. And my uncle was at what we called for a while the Eastern Asylum for the Insane, and then it became Pontiac State, and eventually became known as Clinton Valley Center, or in a less affectionate manner was known as CVC. I mean, CVC was closed back in the early 2000s and was torn down. had many other family members who have had inpatient stays at psychiatric hospitals. So that's sort of my background. I want to preface my conversation with you today by saying that I think it's important that we remember how we have treated or mistreated people with mental health conditions, substance use disorders, and really overall people with disabilities, because we want to remember it so that we don't do it again. Because even though it's 2026, and I'd like to think that treatment for mental health conditions has come a long way, and indeed it has, we still deal with abuse and neglect in psychiatric hospitals, for example. Um, it still happens. There's still things that happen within mental health treatment that maybe it's not like it was in the 30s when we used to line people up in what we called snake pits, and we gave them shock treatment, whether they needed it or not, and without any anesthetic. But we still have areas where we need to be thinking about, are we really providing treatment that's going to be beneficial? So all those questions may come up today. As Kristen indicated, please put your questions in the chat and she'll let me know what those are, and I'll do my very, very best to answer them. The final thing is I wanted to incorporate video into this presentation, but Zoom and I were not feeling the love today. So but if you're not familiar with it, PBS, Public Broadcasting, about 4 or 5 years ago, had a really good series called Mysteries of Mental Illness. And they did a great job of talking about many of the things that I'm going to talk about today. So what you're going to see here is, I love that, I don't like it, but there was a quote by Kurt Vonnegut Jr. called "The hand that stocks the drugstores rules the world." And this ad, which reads, "Warning, mental patients are notorious drug evaders. Many mental patients cheek or hide their tablets and then dispose of them. Unless this practice is stopped, they deprive themselves of opportunities for improvement or remission." This is an actual advertisement that appeared in a hospital magazine called Mental Hospitals. It's talking about Thorazine. And the reason I like to include it is because it really sort of demonstrates the amount of stigma that there was towards individuals with mental health conditions. And I'll talk a little bit more about the development of chlorpromazine, or what we know as Thorazine, in a little while. But I always like to open the presentation with this because this was an actual advertisement. If you've not heard of Robert Whitaker, he wrote a lot of books about how psychiatric treatment has harmed people. And he actually had sort of started what's called the psychiatric survivors movement. He calls it mad medicine, part of what we would call the anti-psychiatry movement. But what I like at the very end is when he quotes Dr. Howard Rusk, that mental health conditions really are medical problems requiring medical care. I think we might finally be getting to that place where we look at mental health conditions as medical problems, because you can't really separate the brain and the body, the mind and the body, although that is something that we've done historically speaking, is looked at the mind as being separate from the body. So what we're going to talk about today is a brief history of the asylum, how we propose to treat mental illness in the 1800s and beyond, kind of a big overview, a brief history of the eugenics movement in the United States and how it impacted psychiatric treatment. I'll define, if you don't know what eugenics is, I will define that in the presentation. The treatments, the good, the bad, and the ugly, and stigma and its impact on mental health public policy. So why talk about the history of psychiatric treatment? Well, one is to remove stigma from psychiatric conditions, because one thing that I have seen over and over again is that stigma, unfortunately, is still alive and unwell in 2026, but stigma still informs mental health public policy. I.e., we can look at the fact that even though we had a federal parity law passed in 2008, in other words, requiring that insurance companies pay for mental health treatment in the same way they would pay for medical treatment, Medicare is not subject to that federal Mental Health Parity Act. It's the Mental Health Parity and Addictions Equity Act of 2008. So Medicare doesn't have to follow that aspect of the law, which seems discriminatory to me, because who typically is on Medicare? Well, persons with, you're either disabled or you are a person who is over the age of 65 and you're eligible for Medicare. We want to learn from past policy failures. One that comes to mind is the way that deinstitutionalization was handled in the 60s, 70s, 80s, and 90s. To encourage professional humility, meaning that treatment should be reviewed for effectiveness and appropriateness. We do a much better job of that in the 21st century, but back in the 30s, the 40s, the 50s, the 60s, when we had some pretty barbaric, air quotes, treatments, they weren't exactly reviewed for effectiveness or safety. And to understand and prevent abuse. And frankly, so we don't go backwards. So we don't start repeating some of the things that we did in the past, which is something we should always be paying attention to. So some of you may remember in a psychology class, some textbooks talk about Clifford Beers. Clifford Beers wrote the book, A Mind That Found Itself, in 1909. He founded the Committee for Mental Hygiene. And then he went on to found the National, basically the National Mental Health Association at the federal level, with someone a lot of you psychology majors would recall, William James, who is considered to be the father of modern psychology. They founded this national association. The Mental Health Association in Michigan, which was originally called the Michigan Society for Mental Hygiene, we are an affiliate of the National Mental Health Association. And one of the things that, well, one of the primary focuses of Clifford Beers' work was that he had been in 3 or 4 different state and private asylums, if you will, because he had a nervous breakdown after his brother had some health problems. And he saw some deplorable conditions in those facilities and vowed that when he got out, he was going to commit his life to making sure that folks had better treatment in those facilities. And actually that really informed when the Mental Health Association in Michigan, when we were founded in the 30s, there were a lot of people incarcerated or in state psychiatric hospitals across the United States. Here's what Beers said. They thought I was stubborn. In the strict sense of the word, there is no such thing as a stubborn, insane person. When one possessed of the power of recognizing his own errors continues to hold an unreasonable belief, that is stubbornness. But for a man bereft of reason to adhere to an idea which to him seems absolutely correct and true because he has been deprived of the means of detecting his error, that is not stubbornness. It is a symptom of his disease and merits the indulgence of forbearance, if not genuine sympathy. So I think one of the things that he's talking about here is that there are people who don't know that they're dealing with a mental health condition. And of course, we have a term for that called anosognosia, which means folks sometimes don't know that maybe they're struggling with something. And so it speaks to the idea of don't judge the person, have some sympathy and empathy for their condition. So just a brief look at treatment philosophies in the United States. During the colonial period of American history, most people with mental health conditions were cared for by members of their family in homes or in homes that were subsidized by the local community. Um, and a lot of times, depending upon the disorder, these loved ones were hidden from view. Later, states started to establish what were called almshouses or poorhouses, and people with mental health conditions and disabilities were housed with indigents as wards of the local community. So the treatment that people got in the almshouses and the hospitals were not humane. And the other point that I want to make too is that when we didn't have treatment for tuberculosis, they used to take people with tuberculosis and they would put them in something similar to almshouses or poorhouses. And they would often put the individuals with mental health conditions and people with disabilities in with the people with tuberculosis. And of course, we know what happened. These individuals would become infected with TB. Moral treatment began with Philippe Pinel in France and a hospital for the insane in Paris. And I find it interesting they call it moral treatment because basically it's treating people with compassion, kindness, and personal care. Like that was the road to recovery, wasn't chaining them to walls, which is what often happened, or locking them in rooms, or chaining them to tables, or putting them in isolation and forgetting that they're there. And then in the middle 1800s, a lot of you have probably heard of Dorothea Dix, but she began the movement toward the development of state psychiatric hospitals. And it began as a really, really good model. We'll talk about that in a moment here. So as care moved, for people who had more serious mental health conditions, moved to state hospitals, we saw more than 300 mental hospitals develop between 1845 and 1945. And hospitals were supposed to provide the more humane treatment. And what we saw with Dorothea Dix was large state hospitals that were built in accordance with what was called the Kirkbride plan, Thomas Story Kirkbride. The Kirkbride model was that people should be given compassionate care, similar to Philippe Pinel. And these institutions that developed were on many acres of land. And the patients lived there, of course, and of course the staff also lived there. There was often these facilities had their own gardens, they had their own dairy farms, they had their own bakeries. I know that there's a bakery at Kalamazoo State Psychiatric Hospital because I heard stories from people that were there who worked in the bakery. They were self-sufficient, they had their own machine repair shop. And a lot of times what was really beneficial for the patients was the ability to do things like work in the gardens, help cook the meals, and those types of things. And that was part of the intention, that to create like a community atmosphere. What eventually happened was, in accordance with the Kirkbride model, though, it was something that started off with a very good idea. And the administration building, by the way, was usually like right in the center of the development. And then there was the hospital that was for the people that had the more significant conditions, but the more well that you became, you would be relocated to cottages that were kind of flanked out away from the main hospital building. The oldest state psychiatric hospital in Michigan is actually Kalamazoo Psychiatric Hospital, which is still open. Again, Michigan Asylum for the Insane. It wasn't completed till 1869, but it was opened in 1859. And it was built in accordance with the Kirkbride plan. If you ever visited or saw Kalamazoo or like Clinton Valley Center before it was torn down, and I actually, as a case manager for a CMH many years ago, 30 years ago, went to Clinton Valley before it was torn down. It was Victorian, but it had this real feel of kind of being creepy. And I remember hearing from people that had been case managers at the CMH since like the 80s, that you could go down into the tunnels of Clinton Valley Center and you could see where people had been handcuffed to the walls. CVC had the reputation for being one of the most notorious, worst state psychiatric hospitals in the country. And so here we go. An asylum, according to the Kirkbride plan, an asylum was intended as a place of structured improving activity, seclusion from suspected causes of illness, and a certain amount of medical therapy. When you think of an asylum, you think of being kept safe. I mean, when we say we're going to offer asylum to somebody, we're saying we want to do something that keeps the person safe. And so it kind of had two purposes. One was to help people, although at that time we had no treatment. There was no understanding. There were some thoughts about what could potentially cause a mental health condition, but we didn't really objectively know. So there was that. I also think part of it was before state hospitals, as communities grew, they didn't want to see people with disabilities, mental health conditions, developmental intellectual disabilities wandering the countryside, which is kind of what started happening. And then the states took over the care of these individuals. There's a picture of Kalamazoo in 1859. You can see the rather Gothic, looking structure. And this is another picture of Clinton Valley Center, Eastern Asylum for the Insane. And this is the old Traverse City State Hospital in 1885. You can see how huge these hospitals were. Well, I remember I grew up in Wayne County, and I'm sorry, we were going to watch this video, but it doesn't want to work for us. But I grew up in Wayne County in the city of Westland. And we lived not far from Eloise and Walter Reuther State Psychiatric Hospital. As a matter of fact, quick story, because we had family members with mental illness and because my mother liked to go to church that lasted for 30 minutes. There was at Walter Reuther, which was literally 10 minutes from where I grew up, they had a Catholic mass at 4:30. And I remember as a kid, my mom getting me, my brother, and my cousins, we'd all get into my mom's car and we would go to the 4:30 mass at the hospital with the patients. And one of my memories is that my mom was a smoker and the patients found out. And so there's a part of the Catholic Mass where you say, "Peace be with you." And a lot of the patients, one in particular, would go up to mom and go, "Peace be." And then she would say, "Cigarette, cigarette." It's kind of interesting now that I think about it years later. Our family brought a couple of the patients home for Thanksgiving dinner one year because we got to know them so well. So Clifford Beers documents his experiences in a state mental hospital. We already talked to Mine That Found Itself. And even though we had care that was intended to be provided we didn't think about least restrictive setting. Again, we didn't have any treatment. A good thing started by Dorothea Dix, Thomas Story Kirkbride. What ends up is we end up with all this tremendous amount of overcrowding. Like, I remember reading a statistic, it's not in the slide, that these cottages were intended for like 5 or 6 people, and they would have like 20 people crowded into them. Sometimes people slept on porches. So hence we started with the mental hygiene movement. Again, that goes back to Clifford Beers. Now we're going to talk about eugenics and sterilization, deteriorating conditions. Robert Whitaker, again, if you're really interested in this, I highly recommend reading Mad in America. It's a great book. But what's interesting is he says at the turn of the century, there were 126,137 patients and 131 state asylums across the United States. 40 years later, which would be in the 40s and the 50s, there were 419,374 patients in 181 state psychiatric hospitals. So by the time 1963 rolls around, which we'll talk about in a little bit, the signage of the Community Mental Health and Mental Retardation Centers Construction Act of 1963 that was signed into law by President John F. Kennedy, we had almost 500,000 people in state hospitals across the United States. So as conditions worsen, we start hearing more about it in the public. And so if you have not seen the movie called The Snake Pit, I rewatched it this week. I highly recommend it because it was nominated for Best Film. Olivia de Havilland plays the main character. Virginia Cunningham, but it's based on the true story of a woman named Mary Jane Ward, who was actually in a state psychiatric hospital, and she talks about her experiences. And the reason why the film is called The Snake Pit, and it actually comes out in the film, is that the ancients used to believe that a way to heal somebody from being, mentally ill, I hate the word crazy, was they would throw them into a pit of snakes, thinking that, the pit of snakes would scare whatever it was out of you. And that's what they did. The other thing about The Snake Pit, the movie, it's realistic in its depiction of the conditions, because when you look at, there's this one part where you see people literally in these huge wards where they are headboard to headboard, footboard to footboard, side by side, and they would literally have to crawl over the other patients just to go and use the bathroom. I mean, it was pretty barbaric back then. And a lot of times, because this is like, we didn't have federal funding, this was all state funded. And so if the state had a funding problem, one of the first things that got cut was the mental health treatment and the care being provided to individuals in these hospitals. And then, so when The Snake Pit comes out, it was published in 1946. When it comes out, and then it's made into a movie, it actually is one of the impetuses behind the development of the National Institute for Mental Health, or NIM. This is, I'd like to highlight this. Nowadays, there can be a lot of negative focus on media and news, but good news stories or films like The Snake Pit have done a lot to further the cause of civil rights for individuals with mental health conditions and bringing to attention the deplorable conditions that a lot of people lived in when they were in these facilities. Now we have to talk about eugenics. So in 1883, Francis Galton, who was the cousin of Charles Darwin. So when we think of Darwin, of course, we think about genetics, we think about the survival of the fittest. He coined the term eugenics, which means well-born, eu meaning good, genes meaning genetics. And so the idea of eugenics was to improve the quality of the human race by encouraging the reproduction of humans with desirable traits and discouraging those with weaker traits. In other words, if you come from a good genetic line, a good lineage, where there are no problems, then you should be able to procreate. If you have bad genes, disabilities, problems psychiatrically, then maybe you shouldn't be allowed to procreate. And the reason I bring this up is because we need to talk about marriage restriction laws and also sterilization laws. So eugenics was a way of cleansing the gene pool. So it basically, what the problem was it focused on reducing, as the term says here, degenerate offspring by preventing those that had undesirable traits from breeding. So Galton had this viewpoint that basically it was all inherited. So if you had a problem with alcohol, it was all inherited. Negative eugenics was based on the degeneracy theory, which means that you were unfit because you came from a poor environment and damaged heredity. American eugenicists focus mainly on the hereditary component. And they believe that, these social problems, alcoholism, poverty, were all caused from genetic defects. And I'm going to get to why we're talking about this in a minute, because it really affected the way that we provided treatment to people with mental health conditions. So laws were established to address the feeble-minded. And I want to say this, I probably should have said this ahead of time. There are terms that are used that we would not use today, like feeble-minded, moron, idiot, were actually considered, I wouldn't call them clinical terms, but they were terms that were used to describe people. Of course, lunatic, Luna being the moon. So the first way that eugenics got started was through marriage laws. In other words, it was illegal in Connecticut. So Connecticut had the first law illegal for people with epilepsy or who were feeble-minded to marry. And then we did in 1903, we had what was called the American Breeders Association, which was to study eugenics. Then in the early 20th century, led by California, we had what was called forced sterilization of people in mental hospitals. Many of these were performed on people who were minority groups. 33 states would eventually allow involuntary sterilization, and Michigan established its own sterilization and marriage restriction law in 1905, following in the steps of the state of Connecticut. I did some research on this. In 1897, we became the first state in the nation to propose eugenics legislation. And this called for castration of certain types of criminals and degenerates. However, the legislation did not pass. And then in 1913, we adopted a forced sterilization policy, which applied to the mentally defective or insane in public institutions. Again, not the term we would use today, but what we had back then. So the problem with the eugenics movement, well, there were lots of problems. And a lot of people think that eugenics started with Germany, and it actually started in the United States. Now, what you've probably heard about is that prior to the mass killing of the Jewish folks by the Nazis, Hitler experimented on people with disabilities and killed over 200,000 people with mental illness and other people with disabilities to test the way that he would do it, I guess. I don't know. But there's a film, if you're ever interested, it's a documentary, A World Without Bodies, that talks about what were called the Nazi T4 experiments. It's disturbing, a disturbing film, but it does a good job of depicting what actually happened to those folks. We also had a film called The Black Stork. Now, The Black Stork was a film that actually promoted eugenics. It's a silent film. The first film was released in 1917 under the name The Black Stork. And then it was re-released in 1927 as Are You Fit to Marry? And again, it's all about this case by a real doctor named Harry Hazelden from Chicago, who convinces the parents of a baby that's born with multiple disabilities that it's better to let the child die than to perform surgery on the child that would save its life. And so, it raises a lot of moral and ethical questions, but more than anything, it's disturbing because it shows where we were at in this country with regards to people with disabilities. We did not see them as having any value in our culture. And I think that's why it's important to to remember these things so that we don't ever go down that road again. Because people will say, well, we couldn't. Well, I think that we could. And I think we need to be remembering the things, the atrocities that have been committed against people with disabilities. And then here's just an ad. By the way, if you want to, now again, Black Stork or Are You Fit to Marry is a silent film, but it's actually available on YouTube. If you can wait for the 10 minutes for the film to start, because there's a lot of, you can see where the film is sort of getting itself ready to go, and you got to really pay attention because there's no volume. But I highly recommend it. It gives you a really good sense of where things were at the turn of the 20th century. So here's a quote you can read for yourself. This is from the Joint Commission on Mental Illness and Mental Health. And what's interesting is I like where they say this is a field where fads and fancies flourish. And I think that's still true today. I still think there's a lot of different therapies out there. There's therapies that are evolving, whether it's a psychotherapy, whether it's a medication. I think what was said in 1961 is true 65 years later. So this is a little bit about the ugly side of psychiatry. And I want to say this. I am a mental health advocate, disability rights advocate, but I'm also an LMSW and I've done a lot of clinical work. And I want to make sure that I say that I think all things require balance and boundaries. The treatments that I'm going to go through today, a lot of them you've probably heard of, some of them you might not have heard of. I like to think that they just didn't know what to do. They didn't understand the human brain very well. So we're going to talk about hydrotherapy and ice baths, insulin coma therapy, metrazole convulsive therapy, which was similar to ECT. I think the most barbaric of all is the prefrontal lobotomy. Fever therapy, which was taking the blood of people who had malaria and injecting it into people without malaria, thinking that if they induced a fever, the psychosis would improve. Medications, and then, of course, electroconvulsive therapy. So we're going to start with the prefrontal lobotomy. This is Walter Freeman. There's a book about him called The Lobotomist. And he is the one who, I do not want to say the word perfected, but he became the most well-known for the prefrontal lobotomy. Now, the lobotomy actually was not started by Freeman. It was actually started by Egas Moniz, a Portuguese neurosurgeon, who was doing what was called a lobectomy on an animal. And he gets to know Walter Freeman. In 35, Moniz experiments on a female patient. And what they figured out was he injects alcohol into the white matter of the frontal lobe. So the frontal lobe, the largest lobe of the brain, the one that we typically know the least about, is the part of the brain that makes us human. I mean, it's our executive functioning is there, our emotions are there, and we have what is known as the limbic system. And the limbic system is sort of like where the emotions are. So they figure out that if they mess around with the neuron structure in the limbic system, and I hate to say it, but kind of scramble it up a little bit, people become a lot more docile. Well, then they go ahead on, and Walter Freeman creates the lobotomy because the frontal lobe is obviously the front of the brain. And in order to get to the part of the brain where the neural connections need to be severed, you have to go through the orbital bone of the eye, which is the thickest bone in the body. So what does he do? Walter Freeman does. First he uses an ice pick, and then he perfects it by creating some sort of a tool that's similar to an ice pick to go through the orbital bone of the eye. What makes things even more challenging is that the Nobel Prize in medicine is given to Moniz in 1949 for psychosurgery, i.e., the frontal lobotomy. And actually, there are people out there who are survivors, still people that had to endure the lobotomy. And there's been a movement to get the Nobel Prize folks to take that prize away from him because of that. Because since he gets the Nobel Prize, there's this assumption that somehow prefrontal lobotomy is safe, you know, and so they start engaging in all of these prefrontal lobotomies with individuals. I've got Frances Farmer. If you've never seen it, the movie Frances with Jessica Lange is really, really good about her story and her history of being in and out of state psychiatric hospitals. So a lot of you may know the story of Rosemary Kennedy, of course, John F. Kennedy's younger sister. When she's 23 years old, her father, Joseph Kennedy, has Freeman perform a lobotomy on Rosemary. Unfortunately, it goes completely wrong. She's unable to speak, she's unable to walk, and she's taking care. She's in a Catholic institution where the nuns care for her. She was there for over 60 years, and she died not too long ago. I think it might have been about 5 years ago. I have to check that she passed away. She's one of the reasons why we have community mental health in the country and obviously in the state of Michigan is because of what happened to her. Kennedy did not find out that his sister had been lobotomized till 1961, when he was in the first year of his presidency. So we also have electroconvulsive therapy or shock treatment. It was created in the 1930s for the treatment of schizophrenia. I think it's worth mentioning here that most of the people who were in state psychiatric hospitals had psychosis of some form. Although at the beginning of the 20th century, it wasn't unusual to find large numbers of people who were in these large state hospitals or asylums because they had born infected with syphilis. Years ago, when I was the advocacy director for the Ability Center of Greater Toledo in Ohio, I was part of the Toledo State Hospital Cemetery Reclamation Project. And what it was a lot of people that died who were buried, when they were buried on the property of the state hospitals or the almshouses or the poor farms. And frankly, a lot of times they were put into a pine box. They weren't even given a tombstone. They had numbers on their caskets. And one of the things that the Cemetery Reclamation Project did for the old Toledo State Hospital was we were looking to find where the bodies were so that we could protect the cemeteries. At that time, the University of Toledo had purchased a big part of the land from the state hospital, and we were concerned that they would bulldoze the cemeteries where people were actually buried. And so volunteers would use different means to locate the bodies, try to find the number of the tomb of the grave of the individual. And I remember when I worked on that project being shown the types of disorders that people had back in like late 1800s, early 1900s, literally included things like I mentioned earlier, moronic. If somebody had been born with syphilis, because syphilis, invaded the central nervous system and could cause what looked like mental health conditions and paralysis, it was called paresis or lose, all different types of names. There was actually, I remember reading, there was a set of twins that were born in the state hospital and died in the state hospital. So going back to electroconvulsive therapy, a lot of times, the whole idea was they figured out that if you shock the brain, it seemed to reset the brain. The problem was with ECT in the beginning is they administered it with no anesthetic, and it often caused injury to people, and it was given to people that didn't really need it. Um, and so it was often harmful. Famous people that have had ECT, you can read them here, including Dick Cavett, Judy Garland, Ernest Hemingway. Um, Nowadays, we use ECT for individuals who have severe treatment-resistant depression and severe treatment-resistant psychosis. It does seem to work. The problem with ECT is that it causes severe short-term memory loss. So you can read the statistics here from Mad in America, but approximately 10,000 people were lobotomized in 1950 and 1951. And lobotomy was not outlawed until the 70s, by the way. As a matter of fact, that was when Frances Farmer was subjected to her lobotomy. So these are just some statistics. So now we're going to talk about the development of medications. And the very first antipsychotic was chlorpromazine, or what we know of as Thorazine. So Thorazine was developed in 1952, came to the United States in 1954. And basically, as Robert Whitaker writes, belonged to a class of compounds known as phenothiazines that were developed in the late 1800s for use as synthetic dyes. What's really disturbing is knowing that in the 30s, the U.S. Department of Agriculture used these phenothiazine compounds as an insecticide to kill swine parasites. What they found is when they developed the medication is that people became calmer, which is what they were looking for. They had emotional blunting, or what we would call today flat affect, and the French psychiatrist called it hibernation therapy. Because of the development of Thorazine, it was decided that we at least had some effective treatment, if you will. So Thorazine sort of was the marker, the beginning of community treatment and the beginning of the hope that maybe we could give some people the opportunity to live outside of an institution. And so it was in large part due to the development of Thorazine that Kennedy signed the CMH Centers Construction Act of 1963 into law. And that's where we get CMH. The idea was if we had effective medication and treatment, people would not need to be in state psychiatric hospitals or hospitals. And so here is Kennedy signing the CMH Centers Construction Act into law. Unfortunately, we all know he died 3 weeks later after that. And, you know, the big focus, of course, was moving people out of state psychiatric hospitals and, of course, Thorazine Health. Now, what's interesting, though, is in April of 1963, in Michigan, we had Act 54 of 1963, which became Michigan's version of the Community Mental Health Services Act. And a lot of this was actually driven by the Mental Health Association in Michigan, which was known as the Mental Health Society, the Michigan Mental Health Society at the time. And actually, I have meeting minutes from the board meetings that were held in 1963, where they talk about working on this legislation. What happened was in February of 1963, John F. Kennedy made a presentation, a statement before Congress about the need to address the number of people that were in psychiatric hospitals. And I think that Michigan's version of the law was sort of coming on the heels of that, because he says, he talks about this act is designed to encourage the development of preventative, rehabilitative, and treatment services through new community mental health programs. And that was basically what Kennedy was looking to do as well. Okay. When we developed the mental health code in the state of Michigan, which was Act 250, 258 of 1974. And he signed this, this law. When we developed the Mental Health Code, Act 54 was replaced by the Mental Health Code. And one of the reasons for the Michigan Mental Health Code was because people's rights were still being violated in the 70s in state psychiatric hospitals and community inpatient. I've already talked about this. So we had to develop something to protect the rights of people. So what the code did was it established that these individuals in these state psychiatric hospitals or community inpatient, that they had civil rights protections, and these were very much necessary. And unfortunately, if you watch the news, we still have rights violations and unfortunately abuse and neglect that occurs in state psychiatric hospitals. One of the things that I want to say, I'll go back to this slide and then I'm almost done. One of the things that was really disturbing to me when I worked for, now it's called Disability Rights Michigan. It was called Michigan Protection and Advocacy Service when I worked there from 2001 to 2006. It's a federally funded disability rights law firm, basically. And the team that I was on, we monitored the state psychiatric hospitals. And some of the things that I observed in the 2000s were things that I would have seen right out of Cuckoo's Nest. One Flew Over a Cuckoo's Nest. And were very, very disturbing. So unfortunately, we've come a long way, but we haven't come far enough. So that's just a quick overview. I'm realizing that it's almost 2 o'clock and I do want to be able to take questions if folks have them. The good news is that we do have newer medications with less debilitating side effects. For example, we had Thorazine, but since that time we've had a lot newer medications. Those older medications were called typical antipsychotics like Haldol, Mellaril, which people no longer use because it had cardiac side effects, to some newer medications like Abilify, Geodon, Clozaril. I mean, all these medications have side effects though, and they don't work for everybody. But we do have a better understanding of the genetic origins of mental illness. I do believe they are genetic conditions as evidenced by my own family. We do not, well, I would like to say we don't blame parents, but I think on some level there's a tendency to do that. But back in the day, there was the theory of the schizophrenogenic mother. There was the theory for individuals who had autism that they had a cold mother, so they called the mother the refrigerator mother. We also have the rise of anti-psychiatry and the psychiatric survivors movement in the advocacy system, and I all working to protect the rights of individuals with mental health conditions. I think what's interesting about mental health is this, and then I'm going to stop, is the disability rights movement has a real problem with what it calls the medical model. And I've been thinking a lot about this. The issue, though, is that people with mental health conditions actually do need treatment. And they need medical intervention at times in the form of medication, sometimes in extreme circumstances, maybe ECT. They do need to be hospitalized from time to time. And the question will always boil down to, how do you balance the rights of the individual with the fact that society also, from time to time, individuals with severe symptomatology can become homicidal. They can also become suicidal, but we often forget they can become homicidal. And so society needs to be protected from individuals that could, without meaning to, which is what, paraphrasing the mental health code, when you look at chapter 4, how do you legally, what is the legal definition of person requiring treatment, could, without meaning to, harm themselves or somebody else, or fails to recognize the need for treatment. So Thank you. Here's the bibliography if you wanted any additional information. And appreciate your time today.
Thank you, Marianne. If anyone has any questions, you're welcome to drop them in the chat or unmute yourself and state your question. Kathy Johnson said, I believe the Kirkbride model was also big at Traverse City Asylum with beauty is therapy motto.
Mm. Mhm. Thank you for sharing that. Thanks, everybody. If there's no questions, thank you for joining us. Appreciate your support of the Mental Health Association in Michigan. Um, all we Let me just kind of give a quick overview. We do policy work. I am the head of the organization, have been, gosh, the beginning of my 7th year. I'm also a registered lobbyist. Our work is primarily focused on paying attention to mental health, public policy, legislation, making sure that whatever's being proposed is going to benefit citizens of Michigan who need mental health treatment. That's the number one goal. And we do a lot of advocacy. We do a lot of systems advocacy, and I do help individuals and their families who are accessing primarily community mental health services for themselves or their loved ones. Thanks for joining us today.